The lockdown rebellion grows. California has a stay-at-home order for possibly 3 more months, bailing out the bailouts. A judge who doesn't seem to want to let Flynn go, and was intel suppressed that Russia really wanted Hillary to win. Coming up. All right, everybody, welcome to the Buck Sexton Show. Thank you so much for joining today. My, oh my, we have much to get to. The big shift that we're seeing right now is away from the data, testing, although they still talk about that. But they're now increasingly just pushing for what are obviously political goals in this whole process. And you can tell because they're going on offense against people who want the country to reopen. Doesn't everybody want the country to reopen? The only reason that you'd be rooting against reopen is political. There's no honest person out there who thinks that this is a good situation for the American people, that this is a sustainable situation, and yet they keep wanting to drag it out. Dr. Fauci, in the testimony yesterday, I read through the transcripts of it. I didn't have time to sit there and watch Senator's grandstand, but the transcript of it was worthwhile. Dr. Fauci admits that the second that you start to reopen, there will be more infections that occur, and there will be more deaths that happen. This is what we are facing. Now, it's not going to be overwhelming. I don't think it's going to be this massive second wave that people have been talking about, but we got to be able to have a conversation as adults in this country about what the future looks like. Instead, what you get from places like CNN, which I really have been thinking about this. I believe the country would be better off, happier, and better informed if CNN just became a DIY network. Although that actually requires some skill. I was going to say cooking network. That also requires skill. You know, if CNN, I don't know, like ran music videos from the 90s or something. You know, there's nothing that you get that's a benefit from this channel even existing. And the DNC has plenty of other propaganda networks. Nobody would miss it except for the people drawing a paycheck from CNN. But they have lots of other options. Unlike conservatives, there are plenty of media outlets for them. But here's what you get. Here's what you get from, for example, Bro Cuomo, who is like, hey, I'm in quarantine for a while, but I was still lifting, bro. Still working up a sweat. Wait, but didn't you break quarantine? Oh, that's right, you did. And got into a fight with a stranger. This guy likes to get into fights with strangers. What a buffoon. Him and his brother, both. The buffoon brothers, really, or the bros Cuomo, as we call them. But here's what passes for discourse now. You got a national, cable news show, and you can expect people to say really horrible stuff about anybody who wants to reopen. If you are sick of being locked in your home, if you're tired of this, of dubious constitutionality lockdown order, of dubious scientific basis as well, oh, it's because you don't care about old people and you're racist. That's the new addition to this. Play clip 4.
It's an interesting juxtaposition, Sanjay, that the president's thing is about being anti-elitist. His buddies over on Fox State TV, anti-elitist. 10,000 deaths are the price tag that their model puts on this. Talk about being elitist. If that's okay, who do you think those 10,000 people are going to be? Who's getting affected the most? The working class, the brown working class. Who's most afraid of reopening too soon? The brown working class. Who's getting sick the most? The brown working class. Who's dying the most? They are. There's nothing elitist about that. It's everything that's elitist.
Do any of you believe for one second that Bro Cuomo, who, because of his last name, got into certain academic institutions that he never would have otherwise, and because of his last name has a job at CNN as a news anchor where he's entirely replaceable and deeply unimpressive. Do any of you think that he really cares about, as he calls it, the, quote, brown working class? This is a guy who shuttles between a multi-million-dollar apartment in New York City and a house in the Hamptons, which, for those who don't know, is the fancy vacation destination within a couple of hours of New York City out on Long Island. I mean, I really ask this question in earnest. Are we supposed to believe that all of a sudden that Chris Cuomo cares so much more than everybody else about the minority working class, and that's why he doesn't like the administration's plan for reopen, which The administration's plan for reopen has been approved by and signed off on by the public health experts that are, I think, having far too much influence in this whole process. But this is where it all goes. You're going to see a series of emotional and moral blackmails occur in the weeks ahead, in the days ahead. It's already happening. But this is what the argument's going to turn into. It was you want old people to die, and now it's you want old people and minorities to die if you believe that a disease that has a 99.9% survivability rate for everybody under the age of 70, if you believe that that is the case, that we shouldn't shut down the whole country, you don't care about old people. And now they're saying you don't care about minorities. As we know, the disease does not discriminate between minorities and anybody else. It's a virus. It infects human beings. But because of demographic distribution, particularly in New York City, and the density and the public transportation system and a few other factors added in here, yes, it has had a disproportionate impact on people who live in some parts of the city that are largely minority. But it's also infecting people all across the country, and people of all backgrounds and ethnicities are getting this and dying from it. Interestingly enough, I was surprised to see the numbers because I think that there was an anticipation that we had been thinking that, well, one, it was going to be a lot higher overall, but smokers don't seem to be at as high of a risk for this. In the early days, smokers were, I know some, I talked to a few about it, and they were terrified. It turns out that smokers aren't really at as high risk for this. But regardless, the moral blackmail attempt here should be met with, first of all, the disdain that it deserves. I mean, Chris Cuomo is being, this whole thing is disingenuous. What does he want us to do? We're just going to stay locked down forever. We're going to allow the economy. It's the damage that is happening now economically. You won't really even be able to understand it for months to come. And it might even be years before we're able to see the full and long-term impact of it, as well as the immediate damage of 30 million people unemployed, of businesses that we keep thinking we're going to come back, we're going to hit our stride, will be something close to previous capacity. That's not true. That's not true for the two reasons of the regulations and the restrictions that are being put on these businesses. It's also not true because there'll be much less demand. And then there are whole industries that I think are at risk. I mean, there's an expectation right now that the airline industry might end up having to lay off 100,000 people this fall. What do we do? I mean, how do we get our airline industry back before there's a vaccine? You know, you're going to start to see entire business sectors that are effectively collapsing. This is why we have bailouts of bailouts already, and bailouts of state governments and bailout of local governments. And you're going to have bailouts of more companies and individuals. Now, the individuals aren't really getting a bailout. It's a rescue, and it's a rescue in response to a government policy. But that all said, we don't have the money for this. So we can be honest about this and understand that this is not a solution. And no public health expert will go on TV and say it is, to just keep our heads down, stay at home. You know, I think it's so fascinating, too, for all of Chris Cuomo's bluster here about as he calls it, the brown working class. Who does he think a lot of the frontline workers are? Who does he think a lot of the people who are still delivering food, who are still, working for UPS and for the Postal Service and working in grocery stores and working in pharmacies? There's a considerable contingent. I mean, I don't know what the percentages are, but plenty of them are minorities, and they're still risking their lives every day. If you believe that being outside and conducting any kind of business is risking your life, which is what we're all being told. It's always risking your life, right? You leave your house, and I've said this to you before, I'm always reminded of the line from the movie Heat with Al Pacino where he says, you get killed walking your doggy, which is true. You can. And I walk the dog several times a day, despite the fact that it is possible to get killed walking your doggy. All right. We didn't know. And for anyone who's wondering, well, Buck, why were you okay with the 2-week shutdown? And why were you? Because we were being told that this had a 3 or 4% mortality rate, that it could kill anybody at any age with equal, at equal risk, effectively, or close to it. We thought this was going to be a much more lethal, which is, I know right now with 80,000 dead, how could you be talking about it being much more lethal? But that's what we were led to believe. by all the scientists. I mean, I wasn't conducting field trials and data and looking at what was going on in the hospitals in Lombardy or in Wuhan. We were told that this was going to be, orders of magnitude worse than it was in terms of death. So, yeah, in that scenario, we're going to have to take a pause here and see what's going on. But now we have the numbers, now we have the data, and we can live through this. But you're seeing the game the left is going to play now, and this is for political purposes, because they're not so stupid. Well, at least most of them. Some of them are so stupid. But they're not so stupid in general that they really think that we can just stay in lockdown indefinitely. I don't think they're that dumb. Some of them may be, but most of them aren't. What you're seeing is using this as a moment to pretend that they care so much more about life, and therefore they're the good people, the better people, when also at the end of this, they view an enormous benefit to a continued, now when I say continued shutdown, maybe it's a series of shutdowns, maybe it's keeping us all in phase 1 or phase 2 of the reopen. They want this to go as slowly as possible before the election because they want Donald Trump to lose re-election. That is a major motivation for them at this point. The left, the Democrats, that is at the top of the list. It's top of the list. They also never even grapple with what the projections are for global fatalities because the truly poor around the world are going to be horrifically damaged. Many will lose their lives as a result of this decision of the economic shutdown. I'm also going to need people to explain, who do we blame, as I told you yesterday, and we were talking to Dr. Scott Atlas here about it, who do we blame when we start seeing in 3, 4, 5 months just how many people have terminal cancer that was allowed to grow and continue uncaught for months because of the shutdown? How many? Who do we turn to and yell at when we find out that people who stopped chemo for a while now are in a much worse position and may lose their lives to the disease because the chemo was stopped so that we could fight all hands on deck against COVID, including in places that barely had any cases across the country? Who do we blame for that? Do we get to call up the bros Cuomo? If you listen to the media, you're not allowed to blame Governor Cuomo for decisions that seem horrifically bad now in retrospect across the board, and a record that is appalling. If he's in charge of the health of New York State and has all these agencies and has all these people that are experts advising him, he did a god awful job. He really did. But you won't hear that from the media. That's where we're heading, my friends. It's just going to turn into political trench warfare for the next few months. They're going to try to make this as slow as possible, and they will justify all the economic pain and destruction to themselves with two things. Oh, we care so much about them. We care so much more than Republicans about the minority working class. That's what they'll say. And they'll also say anything to defeat Trump is worth this price, right? I mean, anything to defeat Trump is acceptable over the long run because he's an existential threat to our democracy, as they've been telling us for years. So this is going to be tough. The rebellion is going to have to grow against the lockdown, state by state and across the country. And we all have to be a part of rebelling against it in our own ways.
When you wear a mask, you say, I respect you. That's what the mask says to everyone you walk past. I respect you. I respect you. I respect your health. I respect your privacy. I respect your space. I respect you. I can do anything I want with myself. This is America. But I respect you. And out of respect for you, I wear this mask. And I respect the nurses and the doctors. So I'm not going to infect anyone or allow anyone else to be infected unnecessarily so I don't cause more stress on the nurses and the doctors. This mask says, I respect the essential workers.
Notice how insidious this construction, this construct of the mask wearing becomes. It's no longer about an individual choice. It's not about your risk. It's about all the people around you. This is really just becoming a stand-in for you no longer have any rights. You no longer have any say in anything because it's about saving the people around you. Remember, saving the people around you from a disease that over 99% of people will be fine from. But because of that less than 1% risk, and by the way, they're treating this now. If you have a serology test where you have antibodies, are you still supposed to wear a mask? That's anti-scientific. If you're still supposed to wear a mask out in the open air where there's effectively zero risk of transmission to somebody, that's anti-scientific. We have the data, we have the studies on this. The evidence does not support at least some of what the implications are here of what starts to sound like mask fascism. You know, you better do this or else, because everybody else, because the collective needs it, they demand it. Oh? Don't even get me started on the peer-reviewed CDC published study that said that masks in influenza season don't really do all that much. I know. People, I did a little bit of research this week back into the Spanish flu of 1918, and it is kind of wrongly named in a sense, but they don't know where it came from. There are a couple of different theories. We know that the Spanish press wrote about it during the First World War because Spain was a neutral country, so they didn't have true propaganda restrictions on what their journalists were able to say. There were a lot of infections. In fact, there were battles that were determined in part because there were so many people on the front lines in World War I at different periods who did have influenza and so were completely combat ineffective. And it's not helpful to go back really and read about, because that disease, there was a whole lot of stuff that happened with that one that we're not seeing here. One of the more notable ones is that it went after people, particularly 20 to 40. So people who were, a lot of them who were parents of young children, and you would think at a healthier stage to fight off a disease, but no, that didn't end up being the case at all. But the government, this is why it's so notable. The government failed at effectively every level in this, and you just had a rolling series of collapses of different, healthcare initiatives. You had politicians who made the wrong call. Ultimately, what you take from the Spanish flu of 1918, the history of it, you look at it and you say, our public health experts and our government were effectively worthless. I mean, the disease just ripped through all over the place. They weren't able to really. There was like one example. There are a couple of islands, in the South Pacific where, we don't live on a tiny desert island in the South Pacific or a tropical island in the South Pacific. So the real lesson you take from it is that the government was coming up with all these different things, and they were setting up different medical facilities and putting out treatments. First of all, they didn't have a real treatment for it, so I don't even know what. They were just giving people stuff to give them stuff. At some level, the government's panic turns into just more and more regulations. The same impulse to always write more laws to deal with every problem the government has, just laws upon laws. We're also being given all of this advice from the government about what to do here. And they've really shown us already a legacy of failure in preventing and then combating this virus.
Has anybody in this administration ever asked you or any member to take the foot off the gas of trying to find a cure or any type of countermeasure?
No, Senator, not at all. As a matter of fact, we at NIH, as you know, have been right from the very beginning, put our foot right on that accelerator in every aspect, including the development of vaccines and therapeutics. And as I described in my opening statement, we actually started that in January, literally days after the virus was known and its sequence was published. So no, I have never been told by anyone to pull back on the development of any countermeasure or any basic and clinical research project that we've been involved in.
You won't hear much coverage of the more praise, of the parts of the testimony yesterday that were praiseworthy for the administration, or where they were saying, the Trump administration hasn't stood in the way of anything we've tried to do. We've been hearing this mantra of they don't listen to the experts. They listen to the experts all the time. Unfortunately, experts have been wrong on a whole bunch of stuff. And this then makes me think of where we are with California. Yesterday, it broke in the afternoon that California, according to its public health director, Los Angeles, according to its public health director, was saying that they were expecting to probably be on lockdown for 3 more months. In Los Angeles County, they've had 1,500 deaths from this. You're going to lock everybody down. No more, no going out to shop and live life. You can't go to restaurants. You can't go to bars. You can't buy things in most stores for 3 more months. I mean, are these people insane? This is what the experts, the public health, because look, there's no down. First of all, they're getting a paycheck. There's no downside for them to say, yeah, I mean, let's just keep locking down. They don't want to deal with the heat of people like Cuomo. Oh, you don't care about the working class and minorities. No, that's not it at all, actually. You know who's going to get hurt the worst by the destruction of the U.S. economy? Poor people and disproportionately poor minorities. That also will really affect them. The health implications of the long term for preventing people from doing any preventative medicine, from being able to treat chronic conditions. And then also on top of it, all of the health effects of just being effectively forced to be largely sedentary. I mean, I know people say, oh, you can get out, but yeah, it's different, and you can't see people. You can't meet up. You can't go to classes where you would, you work out. You can't go to the gym. You drink more than you've been drinking before. A lot of people are going to develop alcoholism. A lot of people are abusing drugs. Huge consequences, huge cost to all of this. Los Angeles is like, yeah, let's do this for 90 more days. I mean, I hope there is mass noncompliance, but the problem is now, the closer we get to November, now you have to start seeing it this way, the closer they can push it to November, the better off they know Joe Biden's chances will be. And I know we shouldn't be thinking about it, or we shouldn't have to think about it in those terms. I think Matthew McConaughey released some "let's not make this political" ad. Nice idea, but a little too late, buddy. It's very political. They view this as just how much runway can they take away from the Trump administration to get things back on track and to improve the economy. So the more they extend, they are incentivized now to extend the lockdown to get that as close to November as possible. I mean, really all you have to do, I mean, if they can keep us in a state of even semi-lockdown until August, they must know that the economy won't. First of all, the damage will be enormous. The damage gets greater in time, but also the pull out of the ditch, so to speak, right? The removing ourselves from these difficult circumstances, that will not be able to occur quickly enough for people to give the administration any credit or any faith. And that's how you get a Joe Biden presidency. They're just going to, take the little blankie off his shoulders and take the little thermos of warm milk out of his hands and trot him on up to the victory stage. I'm yelling because I don't know what's going on. And we're all supposed to say, yeah, this guy, he's really got it. He's really going to run the country great. But it's just a figurehead. It's not about, you have to remember this, because I know I like to point out what a horrible candidate he is, but it's all about the mythology they've created around him, the continuation of the Obama legacy. And it's not really about Joe Biden for the left. It's about all the people that then are in positions of authority. It's about who Joe Biden appoints to be head of HHS, who Joe Biden would put on the Supreme Court, who Joe Biden has running the White House. That's what really matters to them. And those people will just be the Democrat power and control echelon. They're already waiting in the wings. This is also why the Bernie Sanders thing, they're like, the people that really call the shots, they're saying, okay, well, Biden, we know, will do what we want him to do. I mean, he's effectively a puppet of the left-wing political apparatus in this country now, of the Democrat establishment, which is the same thing. The left and the Democrats are obviously synonymous now. So that's something to remember as we go through this. But also, with California thinking they might extend their lockdown 90 days, I think it is worth noting that we're starting to see schools claim already that they're not going to be reopened for the fall. Some universities have said they're going to be taking teleclass only. So, virtual classes or teleclass or however you call it. People are really going to be paying $60,000 a year to watch classes on a computer and sit at home. I don't know how, universities got so fat and happy in the last 30 or 40 years. It's just been outrageous. This arms race of the fake credentialing system that they all have set up. There are too many schools for it to even really matter anymore. All the schools are great, and the elite schools bring in bozos by the truckload too for all kinds of reasons, whether it's rich mommy and daddy or social justice or athletics or whatever. The whole university system as the preparatory ground for the leadership of the future, and it's all garbage now. If you want to learn, you really need a baseline level of educational tools and skills, which you can get. And people are finding out you can actually get it at home, but you can also get this by the time if you're in a pretty rigorous program midway through high school, probably. And then after that, just self-directed study, apprenticeship, hands-on learning, working at different things and jobs. That's going to become much more important. Sitting in a lecture hall and writing 2 completely monotonous research papers a semester and doing this over and over again for a whole bunch of different classes. This is not. No one is impressed by someone's psych degree from Oberlin. No one cares anymore, if they ever did. So that's going to be a change that comes out of all of this, I think. I know I always pick on Oberlin. There's some schools that get picked on a lot. Oberlin's definitely one of them. Brown University too. Yeah. An Ivy without grades. That sounds really rigorous. Sounds like people are really working hard there and getting a great education. Sure. I digress. So here's the other part of the opening schools, though. This is where we get into the. I'm focused in on this with testing because I can only make so much noise. I can only tell so many people. Here's a perfect example. This morning I woke up and I just thought, okay, just so we're all clear here, we should be out of lockdown. This is nuts. Just a reminder. That's what I tweeted out. I'm just going to keep telling everybody this. This is crazy now. New York should, in 2 days, allow a phase 1 reopening. The metrics were pretty close to it, but they're going to delay it another 2 weeks. And then if we're a little bit behind the metrics they have, they might delay it another 2 weeks. Well, we shouldn't burn a month because of arbitrary metrics about leaving 30% of hospital beds open for COVID patients when there's no way we're going to have that kind of a surge going into the summer right now. It's not going to happen. Haven't we learned our lesson from the terrible models that they used and how far off they were? They were so wrong on ventilators. They were so wrong on ICU beds, wrong on all this stuff. But now we're supposed to, they keep getting the numbers wrong. The projections about the numbers are wrong. And we say, well, hold on a second. They say, oh, don't worry about that. That's water under the bridge. We say, yeah, but now today you're saying, based on this new set of projections, this is what we need to do right now. And we look at this and go, well, hold on. Don't we get to, aren't we in the trust tree in the nest? Can't we? Nope. Not allowed. You're supposed to listen or else. They don't want to hear it. So you got the CDC director, Dr. Robert Redfield, who was talking about testing. As I'm very focused in on this testing part of it because it's really easy to say. And remember, government never will tell you we can't fix this for you. The government won't really accept that. That's just not in their mindset. They think if they just have more control, they can fix anything. If you give the government more power, it is a belief of government that it will be able to handle whatever the problem is. And this is an enormous miscalculation and misconception. And really our entire system of government is premised to prevent that creep, right? But we've been losing that battle really for the last 100 years or so now, where the federal government is just getting larger and more powerful all the time. But the federal government believes that it can fix the problem. Well, hold on. Let me come back and we'll talk about testing. And yes, there's all these numbers, but there are some things that they're not telling you as they're telling you the numbers. All right, so what's the truth of testing? Mitt Romney was there during the briefing yesterday to clarify that when they said we've done more per capita testing, the president said it, and it was also brought up by Admiral Giroir during his testimony that we're doing more per capita testing. But Romney's like, well, we weren't doing more per capita testing at the beginning of this. Okay, that's true, but that's not what they said. Thanks, though, Mitt. Always good to have Mitt Romney weigh in and tell us that, he's on no one's team. He's on Team Mitt. That's the kind of loyalty you want in a public servant, a guy who only cares about himself. I know there are others. There are lots of others. We could name them, but we don't have time for that right now. So here's what they're saying about testing and how essential it is. Play clip 6.
Rapid, extensive, and widely available timely testing is essential for reopening America. CDC's role in testing continues to support diagnosis and contact tracing, surveillance, and outbreak.
Okay. Testing's really important, right? Here's what they're not telling you. We're already at a point we have excess capacity for the testing that we have in most states, meaning that people aren't getting tested all the time. And for what they're envisioning, they're looking at creating a capacity where you have tests that are so ubiquitous that they're all across the country and people will constantly be getting them. You know what's going to have to happen, and they're not talking about this yet, but I'm telling you, this is the next phase. Mandatory tests for all kinds of things. People aren't just going to show up and get tested for coronavirus. And you're going to have to get tested to really know. And the health experts have said this. You're going to have to get tested every 2 weeks. You can get tested and you're negative, and the next day you get infected. So what is the expectation? They're talking about doing 50 million tests a month by the fall. That's 1 in 6 Americans getting tested, over the course of the month, getting tested in the fall. How is this going to happen? Well, you look at the South Korea model, which I've brought up with you and other places, and there's a lot of you have to get tested. You will be tested. Okay. So we're going to trust the government that didn't see this pandemic coming, that essentially closed the barn door after the horses left with the spread of the virus. Now we're going to trust them to determine how often we all get tested and what the ramifications of that will be. My friends, this is a mess. This is a mess. And it doesn't even have the intended. If you test, 50% of the U.S. population, in 1 month, there's still 160 million people out there who could get infected and could spread this disease to other people. So what do we think that? Yeah, I'm not saying it's not help. Of course, testing has a role. Of course, but let's just look at something that we can all understand. We have testing right now for the flu. And I brought this up, I think, yesterday on the show. And I got the flu a few years ago, and I took the test, and they said, oh, yeah, you got full-blown influenza, my friend, the whole thing. It was very clear. Okay. I had been kind of sick for about 3 or 4 days by the time I went in. And I had been around, I'm sure, plenty of people having no idea that I was sick even before I had any symptoms. So what's the huge... Okay, so now I know that I've got the flu, which I pretty much knew anyway. Do you think that all these asymptomatic people are going to be going in to get tested? I mean, the trace part of this, too, this is where, oh, my gosh, there's all this focus on how we're not up to where we need to be on the trace system. Remember yesterday we're talking to Dr. Atlas and what he said about how the tracing... Oh, here you go. Here's Senator Doug Jones harping on this one. 7, play it.
Are you saying that you think that the federal government and or state governments are capable of doing the level of contact tracing that we will need?
They are capable. Are they capable at this very moment? Absolutely not. We've got to get more money to them. We've got to figure out this plan. Dr. Redfield testified yesterday that he's working with the states. I believe that. I think that the state, I know in my state, they're looking at trying to ramp up all this. We are not capable of doing that at this very moment. But I think we've got the time. We've got the opportunities to do that. We've got to get more money. We've got to get a plan. Those plans are being developed, but they need to put that urgency on those plans. I think by this summer, I think we can do that. Look, we've got the opportunities to learn from these lessons. We've got to seize those opportunities, or as Dr. Fauci said, there's going to be more needless suffering and more needless deaths.
There is absolutely no way that this tracing army of 100,000 people that the lockdown consensus is pushing for is going to be formed in time. And even if it is, to think that this is going to be effective, I mean, you've got to be kidding me. More than half the people by a lot of studies that have this are asymptomatic. So you're going to have some government employee that comes and visits with you and tells you, and you have to tell them everyone you've been around, everyone you've been near. Then they're going to go talk to all those people. Think about how long I went through a federal background investigation, which was a incredibly slow and grotesquely incompetent process that involved countless useless man hours, and that was in the elite echelon of trying to get a TS clearance to go into the CIA. You really think this army of tracers is going to be efficient? What's their training? What do they know about anything? 100,000 people? You're going to have TSA agents, so to speak. No offense, TSA. I know some of you love the show, and I appreciate you keep the plane safe. But you're going to have people who are newly minted federal employees who are going to be showing up and saying, guess what? You have to stay home for 2 weeks, and so does everyone in your family, and so do all your coworkers. Under pain of fine? Oh, yeah, that won't be a problem, folks.